All right, so good morning, everyone. Just a little bit of housekeeping. All of our lines are being muted. So if you hear any background noise, it may be on our end as the presenters, but your lines are muted. If you don't want your camera showing, be sure to make sure that you click the three little dots on the right-hand corner in the video box that has your name and make sure that your camera is off. If you have any questions, as I mentioned before, you can type those into the chat and we will do our very best to get to them. And as I mentioned, if we don't get to your question, we will have a way for you to follow up. So to get us started today, we're going to have a few presenters. First of all, we will have a video from Marshall Vogt. He is our COVID-19 vaccine operations section lead for our COVID-19 response. And so we will be playing a video for Marshall because he's a pretty busy guy at this point, as you can probably imagine. Also, Lean Abdelaziz is our COVID-19 MRC medical surge coordinator. She will be going over our pod or point of dispensing. She will be discussing that. And then my name is Megan Doran, and I'm your VA MRC COVID-19 coordinator. And I'll begin answering some of your questions regarding COVID-19 and talking a little bit about how our response looks and how you can get involved, as well. So next slide, please. So what will you guys learn today? So first of all, after this session, you should be able to explain state and local dispensing systems, and then also points of dispensing operations, or what we like to call pods, and their structure. Also, we're going to be reviewing over some of the CDC COVID-19 vaccination distribution. And we will also be talking about roles of volunteers during medical countermeasure operations, and that's what that MCM stands for, the medical countermeasure operations. So with that, I'm going to stop here and I'm going to share my screen. So Adrenia, if you can unshare. Give me just one moment.
Today, and thank you for letting me talk to you a little bit about what you are going to be helping to volunteer with, and we appreciate you helping to volunteer with this massive vaccination effort that Virginia is undertaking for COVID-19. My name is Marshall Vogt. I'm an epidemiologist with the Virginia Department of Health Division of Immunization, and I'm the operations lead for COVID-19 vaccination within the COVID-19 vaccination unit here at VDH. So we've been working very diligently over the past few months to plan for the arrival of vaccine in Virginia, as well as to plan how to get vaccine out to local health departments, to hospitals and healthcare systems, and to other providers, and to get that vaccine into people's arms. And again, you as MRC volunteers are critical components of our vaccination campaign. And so again, I thank you for all of the work that you're willing to do and all of the work that you will do as we take on this mammoth task. As you can imagine, vaccinating people is something that we do every day in public health, but to vaccinate so many people in such a short period of time poses a lot of logistical challenges. We know that there are several delivery methods that we can use for COVID-19 vaccine. And so we're trying to take advantage and continue to update our plans and revise our operational strategies here in Virginia to take advantage of those. And those are hospitals and healthcare systems, pharmacies, private providers, local health departments, and then mass vaccination clinics, sites where we could have a large number of people come while still respecting social distancing, of course, and receive a vaccine. And what's complicated about this is that it's a lot different from how we've done mass vaccination, say, for flu clinics or even during the H1N1 pandemic. One, we know that COVID cases are continuing to surge across the state, and so it makes it very difficult to deliver vaccine when we already have a very stressed healthcare system, and many of the people that would be delivering vaccine are healthcare providers that are helping to take care of COVID-19 patients. In addition, the two leading vaccine candidates that we have right now require 2 doses, and they can't be interchanged, which means that not only do we have to get people to come to us once for a vaccine, we have to get them to come back within the right period of time and get the same kind of vaccine product again. And of course, it's very difficult to get a large number of people together and administer a vaccine when we know that COVID spreads very easily, especially in closed environments where people are not able to socially distance from one another. There's lots of challenges for the COVID-19 vaccination program, but we know that it really is the key to ending the pandemic, and we're committed to working together to get vaccine to Virginians and people across the United States and across the world in order to stop this pandemic. You've probably heard about a couple of the vaccines that are being used for COVID-19 vaccination. Right now in Virginia, we're using 2 vaccines, one made by Pfizer and one made by Moderna. They're very similar vaccines in terms of their mechanism of action, but they differ a little bit in terms of their storage and handling and dosing and spacing. But they all use what's called mRNA technology. mRNA stands for messenger RNA, and it's something that basically tells our bodies how to make specific proteins. Think of it as almost a stack of copy paper in your body, and your body reads that and it prints out proteins based on what the mRNA says. We do this every day in our cells and our bodies, but the vaccine takes advantage of this technology by actually telling our bodies to produce certain proteins from the COVID-19 vaccine. So when you receive the COVID-19 vaccine, your cells receive a small piece of messenger RNA that codes for the spike protein on the outside of the COVID-19 virus. Our body's cells take in that RNA, and then they produce that protein and release it out into our bodies, where our immune system mounts an immune response to it. It works on the same principles as many other vaccines. It's just that our bodies produce the antigen, that protein that stimulates the immune response, internally instead of pre-prepared antigen being injected into us. These vaccines are safe and they are effective. They've gone through the same amount of rigorous research and clinical trials that all other vaccines go through. It's just we were manufacturing them at the same time so that once those research studies ended and we knew that the vaccines were safe and effective and they were authorized for use, they were already manufactured and ready to start being released, distributed, and administered. mRNA vaccines are not going to alter your DNA. And really the only adverse side effects that have been reported are symptoms that typically occur when your immune system is working and responding to something and trying to build an immune response. That might be fever and fatigue, sometimes achiness or soreness at the injection site. But these are very minimal symptoms. They don't last very long. And they're really a sign, again, that the vaccine is working. And more importantly, it's worth just a couple days of feeling fatigued or having a sore arm as opposed to taking the risk of getting COVID and becoming seriously ill. We know that these vaccines are the best way to beat the pandemic, and we're excited to start getting them out to people. Now, as I mentioned, there's a lot of people that need to receive vaccine, and we don't have tons and tons of vaccine yet because we're still manufacturing it. So we really had to think about how to prioritize who gets vaccine when and why they need to get vaccine. The federal government, Operation Warp Speed, the Advisory Committee for Immunization Practices at the CDC, they met and determined some phases and different criteria for people to be able to receive the vaccine. The phase 1A, or the very early vaccine recipients, include healthcare workers, those that are on the front lines of the COVID-19 fight, as well as those that live in long-term care facilities like assisted living facilities and nursing homes. That's because those individuals are very vulnerable to COVID-19 and poor health outcomes, including, unfortunately, death due to COVID-19. Phase 1A individuals have been receiving vaccine for the past couple weeks. And in fact, some individuals are already getting their second doses, meaning that they're fully immunized against COVID-19. And we're excited about that, but we know that there's more work to do. The next phase, or phase 1B, will include individuals that are 65 years and older, frontline essential workers, and those aged 16 to 64 with underlying medical conditions. That's because this next group really comprises a group that can be at risk, like those that are 65 plus or with underlying health conditions for adverse health outcomes due to COVID-19, or folks like essential workers that are constantly exposed to COVID-19 because they can't work from home or really practice social distancing. We're working right now to refine our plans because the phase 1B priority group was changed a little bit from what it was originally, with the addition of people with underlying health conditions and the expansion of that age from 75 plus to 65 plus. As more vaccine becomes available, we're getting it out to more providers. Remember, initial vaccine really took place, or vaccination really took place at hospitals and local health departments. But now we're starting to see other healthcare providers being able to receive vaccine, as well as pharmacies receiving vaccine. And in fact, many of those pharmacies are the ones that went in and vaccinated people in these long-term care facilities. So as we get more vaccine out, and we're looking at those different avenues for vaccine administration, like pharmacies, like these mass vaccination sites, soon we'll be able to really ramp up the number of vaccinations that are being given here in Virginia. We've set a lofty goal of about 25,000 per day by early February, and we know that we want to scale up even more to about 50,000 vaccines per day. In order to do that, we're going to need more vaccines, more sites for people to go get a vaccine, and volunteers such as yourself to help augment our public health provider force in the community. Once we're well into phase 1B, we'll start to look at the next phase, which is 1C, other essential workers. Folks that keep our country working. They keep the lights on, they keep our infrastructure working, but they're able to maybe work from home or socially distance a little bit more, so there's less of a risk for them being exposed to COVID-19. Those folks are in the next phase, what I said was that 1C phase, and we're going to be turning our attention to them as soon as we're able to. After that, we'll start to open up the vaccine to others in the population who are interested in getting it. It's not going to be mandatory here in Virginia, nor is it likely that the vaccine will be mandated anywhere in the United States by the government. We need people to trust the vaccine, trust that it works, and feel safe that they're getting the vaccine and confident and that it's going to help end this pandemic. You are ambassadors as our MRC volunteers and can help answer questions and allay concerns. And we're excited that you're here to help us do that. Thank you so much again for volunteering and for learning so much about this vaccine so quickly and how we're going to administer it to folks in order to get out into the field and start vaccinating people. We appreciate your help, and we couldn't do it without you. Thanks so much. Be safe and be healthy.
So as you can see, Marshall is one of our biggest cheerleaders in the Office of Epidemiology at VDH, and we will go ahead and pull up the presentation now that we have for Lean to be able to start on for our strategic national stockpile and point of dispensing overview. So I'll hand it over to you, Lean.
Good morning. Thank you, Megan. I can hear an echo. Do you guys hear me well? Okay.
Yes, we hear you.
Okay, thank you. My name is Lean Abdulaziz, and I'm MRC Medical Surge Coordinator. I work with the Virginia Department of Health, the Office of Emergency Preparedness. Thank you, everyone, for joining us this morning. We appreciate your time and your willingness to help us with this great mission. So I'm going to start to give you a little bit of an overview of the Strategic National Stockpile. We refer to it as SNS. And I'm also going to give you an overview of point of dispensing. We call it POD. Next. So what's the Strategic National Stockpile? The Strategic National Stockpile is a nation's supply of life-saving pharmaceuticals and medical supplies that is managed by the USA Department of Health and Human Services, which is HHS, and under HHS is managed by an office called Secretary of Assistant Preparedness and Response. The SNS caches are strategically located in secured warehouses across the United States. Next. So this is a federal asset. This is actually where the one of the warehouses where the Strategic National Stockpile is secured. So what we have in that SNS, we have personal protective equipment, PPE, we have ventilators, we have airway management, and we have pharmaceuticals, mostly antibiotics, and we have testing supplies. Next. So this is these are actual pictures from some of the warehouses. Sometimes we use airplanes to deliver those materials. Sometimes we use trains. Sometimes we use trucks. It depends where it's needed and what's the fastest way to get it. Next. So during an SNS mission, what's the role of the state and localities? We, at the state level, receive those materials, we unpack it in our own warehouses, and we store it, and then we secure it. And once it's ready, we distribute to the local jurisdiction and other state governments. The state is responsible for so many things like planning, training, making sure employees and volunteers are ready for such a mission. Other kind of responsibility also with the public information and communication. We want to make sure that the public is aware of what's going on and they're aware where and when to get their medications or vaccines. The localities are normally in the front line. They receive, secure, and dispense the necessary MCM. MCM stands for medical countermeasures. That could be pills or vaccines. They're responsible to get it to the public in a timely and efficient manner. And they're also responsible for the public information and communication to the public. They want to be in touch with the localities, make sure the locality knows what's going on and where and when to receive the medication or the vaccine. Next. So before I get to the point of dispensing, I just want to mention the reason why I mention or give you a little bit of information about the strategic national stockpile, because that's the way the mechanism that we use to request assets or resources from the federal government. For COVID-19 is a little bit different. The vaccines are coming straight from manufacturers, straight to the localities or to the state. All right, so now into the point of dispensing, we call it pod. I'm going to say pod throughout this presentation. So there's some of the objectives for the next slides. It's going to be we need to understand what public health emergency mean and when it's required to pod activation. We want to describe the types of pod, the purpose, and the functions. We want to also talk a little bit about the pod operation, the function, the different groups, and their responsibility, and your responsibility as well as a volunteer. Next. So what's the point of dispensing? What's a pod? A pod is a fixed, identified public facility in which medical countermeasures, MCM, are given to the people in response to a public health threat or emergency. So we normally have those pods. It's already been identified. The local health jurisdiction know where, when we say activate, they know where to go to activate that pod so they can receive the public to get medical countermeasures or vaccines. So the primary goal of a pod is actually triage and medicate. The secondary is behavioral health and record keeping. And what's the main overall goal is we wanted to decrease the number of individuals who might get ill. So in the pod, we don't treat people, but we actually give them the necessary medical countermeasures so they don't get sick. Next. So the difference between a pod and a regular clinic, a clinic, you go there they check your medical history, they do exams, you have records, and it's very individual focused and it's time consuming. And it's normally, if you need a referral, you'd be referred to traditional healthcare setting, either to a specialist or to a hospital, and it requires a medical professional. So there is medical professionals who deal with you on an individual level. And the pod is a little bit different. There's no exam and it's very limited records. There's certain forms that people have to fill out and it's normally population focused. We want to get as much medication to as many people at the fastest time or vaccines, people arms as fast as possible. And we process it very quick. And as I said, it's the community based. So normally either in a high school or a big parking lot. So it's a community based where people can get in and out quick, and we can get them either the medication or vaccine quick. And as I said, it's normally non-medical, non-traditional stuff, such as yourself, volunteers. Next. So as I said, there's two different parts. There's one we call it non-medical model. that non-medical, we normally give antibiotics, and there is no medical license required because we're just giving pills to people, antibiotics, and we dispense it to the head of the household, meaning the head of household can come into the pod and they can say, hey, I have 3 people in my house. We give them the medication for 3 people. The medical part is a little bit different because it's involved vaccines, injections. Everybody in that household needs to be present to get the vaccine. And normally we require a medical license to give the vaccine.
Hey,
Next.
Lane, it looks like your microphone is maybe rubbing on your shirt and it's causing some background noise.
Oh, sorry about that. Can you hear me now well?
Yeah, that's better. Thank you.
Thank you. All right, maybe I can repeat this slide again. So there is 2 different type of pod. The first one, we call it non-medical pod, and is normally, or we give antibiotics and pills, and there's no medical license required for that type of pod. And the head of household can just come in and get the medication and leave. For the vaccine is a little bit different. Apparently, everybody has to be there so they can get their shots, and we need a medical license for people who are giving the shots. Thank you. Next. So there's some policies in regards to pod operations. We normally don't require photo ID. It might be different from place to place. We normally ask for the full name, date of birth, number, and we just want to know basic information, allergy information, so we can follow up if there is any side effects or anything. There is some media policy. We normally ask the media, they can access it, but we don't give them a greater access to the pod, and they need to follow some rules, and we might give them a place, a designated place they can sit and watch if they wanted to. Next. So this is a participant question for you guys. What do you think the difference between a closed pod and an open pod? Just throwing out there to get you guys thinking. Maybe if you want to answer it, you can answer it in the chat. So just give a wild suggestion. What is the difference between a closed pod and an open pod?
So Lean, it looks like we're getting some comments that a closed is appointment only. And some people have been saying public versus private, etc.
That's close. Thank you, guys. Next. So you guys were very close, or most of the answers are correct. The closed or private pods, we normally use the resources of a partner organization to set up the pods and dispense the medical countermeasures to their own facility, meaning that these are big private companies or hospitals, or it could be a government entities, it could be a military base, it could be, as I said, big companies like Dominion Power, those places, because they have large number of employers, and we normally have an agreement with them that if in case of public health emergency and we need to dispense medication or give vaccines, we're going to send them those medication to their facility so they can take care of their own people and their families as well. Will save us a lot of time and energy, and also will make their employers and their employees on ease that they know that once there's something, they're going to get the right medication and the vaccine in their own facility so they can continue their operation. We have a lot of agreements with, as I said, military bases in Virginia, with hospitals, with big companies like Dominion Power. We have with long-term care facilities, with different kind of facilities that they can, once we send them the medication, they can take care of their own people. The open pod in the other side, it's open for everyone. No restriction. This is open to the public and is normally located in identified community-based facilities that public health agency, we can go quick and activate it to the general public. Next. These are just some of the examples of closed pod and an open pod. I already kind of mentioned it. So as I said, government, we have agreement with jails, with correction facilities, with hospital, with churches, with big companies. And open pod includes sites as like public school, sport arenas, community centers. Sometimes we do drive-through. Sometimes we have big mass vaccination clinics. And we have some agreement also with pharmacies that they can play as open pod to the public. Next. So what are some of the dispensing scenarios? We have some public health events. These we call it natural, or sometimes we have man-made incidents. So natural occurring diseases, sometimes we get outbreaks in different type of diseases regularly. This is something happen all the time. And sometimes we get novel or emerging infections, like what happened with COVID-19, H1N1, 2009. So it depends on the event. These are some of the natural occurring events. Another man-made incidents, some bioterror attacks, is small or large scale. Some of you might remember during 2001, 2002, there was some anthrax letters coming to the Capitol or to different government buildings. This is what we call it man-made incidents, and we normally require a dispensing a pod. Sometimes since it's a large, or if it's a small incident, it'll be just a small pod. Probably not a lot of people will hear about it. We just want to take care of a small population that they've been infected or they've been exposed to certain type of bio thing. Next. So CDC or the federal governments require us to plan for those type of scenarios. We know some of these already been eradicated, is not there in the community or is not there, but it could be made in a lab. So that's why we make sure that we're always ready for any type of scenario. Next. So what do we mean by responding to a public health emergency? We mean at the public with public health, we mean that the ability to provide medical countermeasures, MCMs, in support of treatment or prophylaxis to identified population in accordance with the public health guidelines and or recommendations. With COVID-19 is a little bit different because the whole population it could be it could be infected. So this is a little bit different. But as I said, some small scenarios or small incidents, we normally just identify that population and we make sure to get them the correct treatment or medical countermeasure that population need. Next. So this is normally a response time for SNS, the Strategic National Stockpile. As I said, the COVID-19 is a little bit different because the vaccines are coming straight from the companies. But normally the incident occur at the local level, meaning at a city, a town, a small community center. So it starts at the local, and then the decision will make from the locality, from the health department, health directors, to dispense or activate a pod. When they normally contact the state contact the federal, and we start mobilizing things very, very quick. You'll be surprised that within 12, 14 hours, within 48 hours, that pod will be activated. That's the requirement from the government, that within 48 hours, if we request it, we need to have the pod standby. And this is just to give you a little bit of overview, with deployment of the pod, the staff report to the staff, to the staging site, they check in, they receive briefing, we transport the medication to the pod, and then we open the pod to the public or to that specific population. Next. So where the decision start, an initial action start at the health director at the locality, the health department. Normally the health director is the public health incident command. He's normally responsible for the whole operation for that jurisdiction. And they activate normally the initiate the unified command. They request support from agencies or cooperating agency around the jurisdiction, and they determine the dispensing protocols, what type of pod they're going to activate. If it's a medical, non-medical, is it going to be a drive-through? Is it going to be inside a place? So they're the one who determine how many pods and what type of pod is going to be activated. Next. So pod operation, as I said earlier, the primary goals is triage, medicate, and educate. Normally at the front, we green and screen people, and then we distribute forms so they can fill out, and then we either dispense the medication or vaccinate that person or that population. Next. So there's different roles throughout the pod. We start by, I'm going to give you a little bit of overview. I just want to mention those names might be a little bit different from a pod to a pod. So we're going to start by talking about leadership and the command staff. The leadership and the command staff up top, they manage, they coordinate, and they consult an overall MCM pod side function that include the operation, liaisoning, public information, security, safety, planning, and logistic, and then overall the administration. And that person or those people may report to the emergency planner at the health district or the health director for that health department or that health district. Next. Next.
Looks like we may be having some trouble.
Okay. Maybe I can answer some of the questions. Okay. We moved on. Thank you, Megan. So the command staff responsibility, you can read it through here. They direct, dispense overall operation, and they make sure the resources are there. They communicate with the health, what we call it, emergency operations center at the state level, or the health district, each doc, which is the health district operation center, and they act as resource for the PAL staff. They ensure overall safety of the staff and the clients or people who are coming through the pod. Next. Number two, we have safety officer, or sometimes we call it biosafety officer, and sometimes we have the two position in a pod. What they normally do, they make sure that they monitor the operation and advise the point of dispensing, the supervisors in all matters related to safety. That include the health and safety of the clinic personnel or anybody coming to that pod. Also, they assess and they make sure that there's no hazard or any safe situation. And that person normally report to the pod manager or the clinical supervisor. Next. So the unit leaders and supervisors, these are, it depends how many units in that pod, how many teams. So that will determine the unit leaders, or we call them sometimes supervisors. They overall responsible of the safety and welfare of our staff. So we want to, safety is number one for us in the pod. We want to make sure you're safe, and also clients who coming through the pod are safe as well. They oversee the operation of each unit. They give briefing and updates to the staff. They ensure the staff are receiving accurate breaks of rest. They look for any PPE exhaustion, and they ensure the record and time is being recorded appropriately. Next. So this is how an example of a pod structure. You can see where the pod manager on top, and then you can see sometimes you have a safety officer, sometimes you have biosafety, sometimes we have both of them there, and they normally report back to the pod manager directly, and you can see the different unit leaders here in red. The public information or officer, that's normally somebody from the district who takes that role. So I just want to mention somebody will be trained and ready and be there for answering any public information or media questions. Next. So logistics support, the logistics support, they normally organize, direct, and coordinate the operation associated with any maintaining, personnel, equipment to support the pod operation. That person will report to the logistic unit leader or logistics supervisor, or sometimes directly to the pod manager if there is no unit leader or a supervisor for that particular role. Next. So this is where logistics supervisors sit in, and the red, it could be a runner, it could be an IT, it could be somebody who's taking care of food, making sure all logistic stuff is there. So it depends how big or the pod is. Some pod, it could be just to serve about 100 people. It could be a small pod, or it could be a large pod that there's 5,000 people coming through that pod. So based on the large of or the size of the pod, this structure change. It could be expand, it could be smaller. It's very flexible to add or take people out of this ICS structure. Next. So a vaccinator, it's a very straightforward. They prepare and administrate vaccine to clients, and they normally report to a pod manager, a unit leader, or a clinical supervisor. Next. So the vaccinator support, or it could be a vaccinator support and a medical evaluator, or it could be one person playing both roles. That person ensures the clients receive the proper screen and the medical evaluation pre-protocols. They collect and process patient registration and evaluation forms. They record the time in and out, and they normally report either to a pod manager, a unit leader, or a clinical supervisor. Next. You can see where they sit in that ICS structure and their clinical supervisor. And if that clinical supervisor is not there, they can report directly to the pod manager. So as I said, it depends on the size of the operation. So can you think of any other support role or roles to a pod mission? I'll give you guys a minute to kind of answer that. Just throw anything out there. Any supporting role that you can think of might be good for that, for a particular pod or any pod in general.
So Lean, we're seeing greeter, IT support, parking, check-in, let's see, security, translators, that's a great one. And then emotional support, someone said.
Yep.
Etc. So
Perfect. These are all correct. All of the you guys mentioned, you normally see that in a pod. Next. So as you guys, some of you said, admin support, normally we call them vaccine controller, fillers, screeners, assistants, floaters. Each pod has a different name. So that's why I want you guys kind of just to get an idea of the different positions, but that doesn't mean that you're going to see those names. Just to give you an idea of what are some of the roles and the job description for some of these positions. So this, for the admin, they normally review the forms, they assist the vaccinator by preparing the appropriate type of vaccine, and those they normally or you normally report to either a pod manager, supported services leader, flow or traffic unit leader. Next. So greeter screener, some of you mentioned that. They're responsible to greet the clients, take temperature and make sure people are not have symptoms. They kind of look and see if there is any they visually they can see if there is any ill individuals, because normally in a pod we do not treat people. If they're sick, we direct them to go to a nearest hospital or a clinic or an urgent care. We ask them to leave the pod because we don't want nobody who's infected to infect the rest of the pod. That person also can address such needs as physical, languages services, any type of support services that clients need. Normally the greeter or the screener will help with that. Form distribution review unit. This is a very important unit. They make sure that they record the time in and out. They make sure the forms are filled out correctly. They answer any question that the clients might have. They review the form. They make sure, as I said, all the information are correct. And they also monitor and see if there is any require additional assistance. That's language assistant, wheelchair maybe is needed, whatever that clients need. We make sure that also this unit look for that and see if there is any assistance that they might give to that client. Next. The flow or traffic control unit, they normally play a great role if it's a public, if it's in a parking lot or people will be coming through drive-through, but they also can direct traffic inside a big gym or a big community center. They normally greet the clients. They make sure that they guide them through the pod. If they have any questions, they answer. They also look for any address, such any physical language services, any needs that the client might have or need. Next. So this is just to give you also a look at where they sit in the ICS structure. You can see the flow control supervisor, you can see the critical supervisor, and you can see people under them. Next. So interpretation or special accommodation, some of you mentioned that. They assist, as obvious, they assist non-English speaking clients with understanding the information and process through the pod. They interpret any information between the pod staff and the clients. And they also identify any accommodation needed for vulnerable population, such as children, elder, access and function needs, hearing and visual impairment. And they normally report to a support service unit leader or directly to the pod manager. This is where they're sitting. You can see. Next. All right. So pod demobilization, what do we mean by that? So the pod operation ended for any reason. Either we finished the vaccines, we finished the medication, or actually we've been 12 hours and we need to demobilize and finish that shift. So at the operation at the top, the pod manager, normally they secure the SNS or MCM inventory. They notify the team leaders that this is time for demobilization. The team leaders then will hold a debriefing. They do a hot wash with their team to discuss success and area of improvements. And I just want to say this is a very important time during the pod when we normally they give a debriefing and a hot wash. What we mean by a hot wash, normally each unit leader will gather their teams and talk about some of the area of success or area of improvements. Or sometimes the pod manager will be a big team, all of them together. They will discuss what some of the area that have been success and some of the area that we need to improve. We always learn from those pods. We always change things. We always come back and do things better. So don't be afraid to speak up during a hot wash. If they ask you, what do you think that things that went well, please go ahead and let them know. And if you feel like there's some areas of improvements that the pod will maybe run smoothly next time, speak up. This is the place where you can let them know. And we take each comment, each suggestion very seriously, and we make sure that we want to improve our operation. The general pod after that, staff will assist the facility, demobilizing and cleaning up and setting up for the next pod operation. I think that's all I have. Right? Thank you so much, guys, and I'll be here to answer any questions.
Thank you so much, Lean. And just, we really appreciate Lean. She's got a lot of subject matter expertise in this area. So we will answer questions more at the end. So Lean, if you'll stay on for us. So I can kind of start off with a little bit of tips and training. And again, my name is Megan Doran. So you can go to the next slide, please. So this tips and training for participating in a pod. So we really encourage you to be proactive when you're at a pod. We also want to make sure that you're spotting any kind of problems, especially safety concerns early on as much as possible. An example that may be small things, it may be large things. So obviously large things would be, if there is an issue with the vaccine itself or something like that. But for our current needs, there may also be some small things like, whether a mat is rolled up on the floor. This was specifically an issue. I know when I was working in a pod a couple of weeks ago, or I guess last weekend, my apologies, because we were starting to pull in those phase 1B categories. And so we were having some elderly folks and making sure that they were not tripping over floor mats, etc. So be aware of your surroundings and ways to kind of fix them to make them safer for everyone. Also make sure that you're paying attention to your colleagues' needs in the pod. So talking to your colleagues, making sure that they are able to, take their break, or if they need to use the restroom, etc. And we all work together and make sure that we're covering for one another. And then making sure to be transparent. If you don't know something, please don't assume that you do. We have so many people that are working within these pod environments that someone else there likely can answer a question. So please don't assume. Make sure that you're being transparent and letting someone know that you don't have the answer, but you can find out someone who can. Also, don't be afraid to get your hands dirty. If you are wanting to do some work outside, there's lots of parking lot attendants for some of these pods. There's also traffic control, etc. So pods are really wonderful in the sense that we can really take all sorts of folks and utilize their gifts in all sorts of ways. So we really encourage you to be proactive and get your hands dirty. So next slide, please. So with that, and as I kind of just mentioned before, pod safety and success is completely in all of our hands. And we want to make sure that we stress the responsibility of each and every MRC volunteer and each and every staff member, if they are working for the city government, et cetera, to make sure that you're using the information that you've been provided to make sure that you're doing good, safe, healthy practices at the pod. So next slide, please. So a couple of other safety considerations, specifically for the COVID-19 vaccination, we have a lot of medical staff on hand, and we are gifted in that way right now. So dialing 911 may not even be necessary for pods that have someone have EMS standing by, say in the parking lot, etc. But if you are ever in a situation, both at this COVID vaccine event or any other event, say it's a testing event, etc., please dial 911 in the event of any medical emergency, and also provide CPR or first aid if you are qualified. We'll talk more about CPR qualifications in just a moment, specifically to vaccinators as well. Also, inform your incident commands supervisor or safety officer if there's any kind of injury or safety issues that you identify. As I mentioned before, it could be as simple as a floor mat, but we want to make sure that we're notifying those folks so that they can have eyes on the issue and find out how we can together make a solution for that. And everyone has a role within these pods, and that's what they're such a beautiful thing if you get the chance to deploy out and be a part of a pod, and you really realize how people really well work together. So look for things like PPE exhaustion and signs and symptoms among staff, etc. If you see, kind of any issues that come up. And if you see something, please do say something. Every position that you would work in within a pod has a leader, and that's what's so wonderful about the IC structure, is that everyone has someone that they can go to if they have a question or have an issue that they need to have resolved. So please do make sure that you know who that person is when you arrive to your pod to work, and make sure that you know how to get in touch with them throughout the day. And you'll usually see them, you're usually walking around with a walkie-talkie because they're in contact with other leaders as well. Next slide, please. So now we're going to kind of get into the meat of the matter with the COVID-19 vaccination update. So this is where I'm going to probably be answering a lot of the questions that you've had in the chat. So I know I wanted to mention as well that we've had Jennifer, our state coordinator for MRC, in the chat as well, and I forgot to introduce her this morning, so my apologies. And then Lean also is in the chat and will be helping to kind of collate some of your questions so that we can answer those at the end as well. So next slide, please. So for COVID mass vaccination, as you guys are aware, plans are underway at a federal and state level. The finalization of specifics, of course, depend on the approval of each vaccination by the FDA. So for example, here I've listed when the Pfizer vaccination was given their recommendation. So they were given their recommendation on 12/10 by the ACIP, and then the emergency use authorization went through on 12/12, so December the 12th. And then there are a variety of pod models that can be utilized to give both the Pfizer and the Moderna vaccinations. Those are the two that we have so far, and we'll get into some more that are on the horizon. And the MRC is really serving a critical role in this vaccine administration and distribution effort. So if you were attending our orientation previously, you heard from Jennifer that we have, several thousand folks that have signed up in the last 45 days. I believe it's about 6,500 folks. So if you can imagine that, there's a lot of information for us to get ready so that we can get you ready to be able to deploy. But MRC is going to be the linchpin in many cases of the workforce scale up for Virginia specifically. So we really appreciate all of your efforts. So next slide. So here's a couple of pieces of information. I will say the status of this has changed, but I wanted to keep up this this information because the storage and type and administration is still very relevant. So as you can see here, Pfizer and Moderna, which we are both now using and have both been given the FDA emergency use authorization, they're a little bit different, and I want to make sure that I draw some comparisons between the two. So Pfizer, as you guys may have heard in the media, requires ultra cold storage. That is -70 degrees Celsius or 2 to 8 degrees Celsius for 5 days after it's been warmed up, quote unquote. And then it uses mRNA, as Marshall talked to us a little bit about at the beginning of our conversation this morning. And then the Pfizer requires 2 doses, and those are 21 days apart. Moderna, on the other hand, is very similar, but it has different storage. And in that it can be kept in a freezer, like kind of a normal freezer, not an ultra cold freezer, and requires -20 degrees Celsius. But it is still also an mRNA structured vaccination, and it's given 2 doses, 28 days apart. So a little bit different in terms of the length of time from administration. So the AstraZeneca vaccine and Johnson & Johnson are both on the horizon, and they're estimated to get emergency use authorization approval by the FDA probably sometime in February, but we don't have the exact dates for that yet. So next slide, please. So I wanted to make sure that you guys see this. This is the CDC vaccine distribution plan. So this was created by the Center for Disease Control, and it's really the basis for all the state plans, including ours in Virginia. So as you can see, this has our phase 1, phase 2, phase 3. Now at the very bottom, I think you can probably see it's very, very small, and my apologies. I wanted to fit it on this slide so that you could at least see that trend. But the phase 1 and phase 1A and phase 1B that we'll go over in just a second, those have been broken out a bit further. And those phases have changed slightly. But really what I want to get your takeaway from here is this big ramp up, what I like to affectionately call the roller coaster. And we are just beginning the roller coaster of sorts. And so we are kind of right now in that big red circle, which will be the time where we have limited doses available of the vaccination, but that we're trying to prioritize out in groups. So as we kind of go forward, we can look at phase 1A, which we've talked about previously, is including those paid and unpaid healthcare facility workers and those that are working in healthcare, specifically even in pods, which we'll get to. So as we continue on, phase 1A also includes long-term care facility residents and staff. And then we move into phase 1B, which is those that are 65 years and above, essential workers, all of those groups that Marshall detailed to us before in the conversation this morning. So next slide, please. So some frequently asked questions that we have as the phases of MRC volunteers, which one are you guys in? And I know that's been a very popular question this morning in the chat. So I want to make sure that you're all aware that if you are working in a pod setting, you are considered to be phase 1A in terms of your healthcare involvement, because you are working in a healthcare setting. And you were an unpaid healthcare worker at that point. So most of our pods are vaccinating at the day of. I know that there's some concerns about maybe individual concerns about your health and what that means for you about getting vaccinated, say at the end of the day after you've worked a pod. We encourage you very much to make decisions based on your availability to serve, based on your own medical availability and your own medical setting. So, if you are at high risk for COVID, we really encourage you to help with the vaccination efforts when it's safe for you to do so. So what that means may be different for every person, but we really encourage you to, if you're concerned about that, to wait, because as you saw, when we get into that phase 2, there will be much more vaccination available, but we will still need your help. So I want to make sure that I make that very clear. You know, as we get into phase 2, you know, you may likely already have your vaccination, but we will still need vaccinators, and we will still need pod support staff to come in and help us to vaccinate the rest of the public. In Virginia, we specifically have 8.5 million people that live in the Commonwealth. So if you think about giving a 2-dose vaccine, that's a lot of vaccines, and we're going to need you for a while. So if you feel like you can't serve today, that doesn't mean that you can't serve at another time. And we welcome you to look at some of our virtual opportunities, et cetera, if you happen to fall into that category. For who all can be vaccinated in phase 1, we encourage you to go to our vdh.virginia.gov coronavirus page that talks specifically about vaccination, and it can detail out, but for those kind of phase 1B groups that I know have started to come up, especially in the Northern Virginia area. Excuse me. Next slide, please. And we've had some questions about whether or not there is a copy of the Virginia state plan for COVID-19 vaccination. It is available, and it's listed here on our resource page for COVID-19 vaccine. It's at the middle of the page, and you can click on that and read the entirety of the plan. You know, we are adopting pods. That's the neat thing about pods, is that they can shift and form, you know, a little bit differently as we learn. So if, you know, we learn something from one pod to the next, we can make updates. So that is kind of our template framework of our plan, but there may be specifics that are changed by the health districts themselves based on the need. And then another question that we commonly have is, are pod locations already determined? And is there a timeline for when they will take place? They are definitely already determined, and they are also, there is a timeline likely in place, although it may shift slightly. We do have those pod locations already planned, but as we've mentioned probably in some previous trainings, you know, the locations and timelines are not always public. So if we are inviting people by appointment only who may be in those phase 1A and phase 1B groups, we do not make those public, because we want to make sure that we are prioritizing those groups who may have additional risks, say in health, you know, through working in a healthcare facility or due to age, et cetera. So we want to make sure that we are, when we have a limited supply, that we are really focusing it on the right population. Now, that being said, once things open up a bit more, that may change. So when we get into phase 2 and we have a lot more vaccination available, we will be sure to make those changes and notify the public when they can do kind of what we've done with drive-up testing events, and letting them know that they're you know, able to come at this place and at this time to get vaccinated. But for now, we are primarily doing those by appointment only. And so if you have a family member who has gotten a response, but then maybe another person or has not gotten a response yet, the only person that should show up for that pod should be the person that has gotten the appointment. So I want to make sure that I'm pretty clear about that. Next slide, please. And then we've also gotten questions about kind of the information data entered into the system. So right now, primarily throughout the state, we're using a system called VAMS. That stands for Vaccine Administration Management System. And that's used to make appointments throughout our state. And then that directly interfaces. It's called an API for those technical guys out there, guys and gals. We want to make sure that it interfaces into our immunization system, VIS. So that way we can, you know, kind of have that data. I know that the New York Times recently put an article out that's been mentioned several times today. You know, there has been some issues with the data. So we are actually working to change systems a bit into a more data sensitive system called PrepMod. So you may hear that a little bit more specifically if you start to vaccinate in the next few weeks. So, you know, if you are a vaccinator, you may encounter a system called VAMS or a system called PrepMod. But they're essentially medical records that connect to the VIS system and show, that everyone who has received their immunization. And then how long after immunization before there's an immune response, and what's the interval in between. So many of you may know this, but immune response is kind of a building cascading event. So when you first get your shot, say you get your shot today, it takes a little while for your body to create that kind of photocopier mRNA COVID fighters in your body, so to speak, and those antibodies. So it takes about 2 weeks from the point of your first vaccination to get to about 50%, immunity. And then after you've received your second shot, that is when you can start building up to that 94 to 95%. So about 5 to 6 weeks out, you should be 94 to 95% immunity or efficacy from the vaccination. And that goes for Pfizer and Moderna. Again, as we know more about AstraZeneca and Johnson & Johnson, we can certainly update these slides and make that information available. As a reminder, Pfizer vaccine is 21 days apart and Moderna is 28 days apart. So it can slightly differ. So it may be about 5 weeks for Pfizer that you've kind of reached that full immunity. And for Moderna, it would likely be more like 6 weeks. And then who can vaccinate? So I want to make sure that we list that out. Also, I failed to put DOs here as well as MDs, so my apologies here. But first of all, in order to vaccinate at all, you have to make sure that you attend orientation. So I applaud you if you were able to attend your MRC orientation this morning. That's the first step to be able to become a vaccinator. And then also we have a list here of MDs and, like I said, also DOs, PAs, NPs, RNs, pharmacists, farm techs, and farm interns. EMS are also able to vaccinate, but they're able to vaccinate in specific ways. So we encourage you to click on the link that's here, and it'll be put in the chat box. It's our vdh.virginia.gov MRC COVID-19 vaccinator page. And that page has landing information for who all can vaccinate and how, and what all is required in terms of training for you to be able to vaccinate as well. So make sure that you look there. I know that there's probably a lot of people that are dentists or dental hygienists. We have there has been legislation put forward to the governor's office for an executive order to amend Executive Order 57. We expect that that will allow for dentists and dental hygienists and as well as veterinarians to also be able to be included in that non-traditional vaccinator category, but that has not been fully approved as of yet, so we can't put that up on the slide today, but we will be sure to update that soon.
Hey, Megan, can I just jump in on that? Because there has been
sure.
a lot of questions in the chat box. So I reviewed the proposal for the amendment to Executive Order 57 yesterday afternoon. And just want to kind of make some comments on that. As far as students, yes, medical students, nursing students underneath the supervision of their faculty advisor can vaccinate. They've increased the supervision. I think medical students, it's 1 to 12. There are many EVMS, a couple of medical schools that are creating vaccination teams that will actually come and plug into our pod operations. So they're going to kind of be a little vaccination team that plugs in. EMTs, there is specific code in Virginia related to EMS providers, and they have to operate underneath their OMD, their operating medical director of that EMS agency, which allows them to vaccinate. So if you are EMS provider, you can't vaccinate as an MRC volunteer. You have to do that underneath your hat or your shirt of an EMS provider. We are looking, there is proposal too that right now, if you have an inactive license, you can go on the Department of Health Professions and reactivate your license. There's been waivers for fees and waivers for education requirements. So that has been taken care of. However, in that new EO, it is going to possibly allow some inactive licenses to be automatically activated without having to go through that process. So not quite sure on that yet, that there's a potential, but there is a current way to reactivate your license very easily. Let's see, what is the other question? Out-of-state licenses. We anticipate that right now, out-of-state licenses can support hospitals, dialysis center, long-term care, so they can do that. We have asked that out-of-state licenses also be able to support VDH, and that will be in Executive Order 57. So just stand by. I'm actually, we're going to create a web page that says who can vaccinate, and go through all of that. So it's going to open the gate quite a bit, but to understand that we already have a pipeline for people, and they're in the pipeline to be vaccinators. So we have volunteers that have been vaccinators for years, and so they're the ones that are like out in the field. And we have lots of people that are in the line for their skills check. And so we're setting up the ability to expand our ability to do a lot of skills checks instead of just in time. So we're opening up the pipeline, but the pipeline that we have right now is giving us the number of vaccinators that we need based upon the limited number of vaccine that we're receiving. Now, once that vaccine pipeline gets huge, the vaccinator pipeline is going to have to expand along with the vaccine pipeline. So we're doing really good in Virginia. It's not an emergency thing because we don't have the vaccine. But just to let you know, we have gotten some amazing response from healthcare providers. And it's been a very busy last 45 days for the admin team, myself, and all the MRC unit coordinators. We've received and processed 6,300 applications in the last 45 days. 45 days. We are approving over 200 new vaccinators every week, and we expect to start to double and triple that. So the pipeline's working. You're in line. You're in line, and some of you might be able to step in the line that couldn't step in the line before. So that's awesome. But, it may not be that you vaccinate now in 1, you might be in 2, you might be in 3. It could be 2 to 3 months from now when people who have been in 1 are tired, that you're stepping up and vaccinating then. So look, there are lots of opportunities for people to give shots in arms. I just want to reassure you of that. There's lots of opportunities for people to help us give shots in arms. And that need is going to gradually kind of increase as the vaccine increase. So that's, I think, just amazing. Guys, we have 23,000 volunteers. That's 13,000 more than we had last year. Holy crud, blows my mind. And I've got 2,000 applications to go and review right now. So it's a good thing. Go Virginia MRC. We got this. We're going to get everybody in the pipeline, and we are going to do amazing work. Blow your mind, astounding, holy cow. There's just no way we could do it without you guys. So just wanted to pop in and give that kind of perspective so that everybody knows. Go team. The team's going to have to get bigger, and it's got there, and it'll get there in the long run. So you're looking at another 5 months of putting shots in arms.
Exactly. And I know there's been some questions about types of training. We've tried really hard to streamline our training for people who routinely vaccinate. So if you go to this link and click on it, it will show you either a traditional vaccinator path, which means that you've given vaccines in the last several years, or a non-traditional, say for someone who has been retired for say a long period of time but would like to go back and get started in helping in the response. Those individuals may have to do a little bit of additional work just to make sure that they're up to speed on their bloodborne pathogens, et cetera. But if you're a traditional vaccinating medical professional, it's a very limited amount of additional training beyond this. And this is actually optional today, but the requirements rather for vaccinating are specific to your skill set. So please just make sure that you go to that link and that you go to those trainings, and once you have received those trainings and you've completed that and you've passed that, you will do a skills assessment. And at the skills assessment, that could be the day of your first pod even. So you'll either be invited to go and do a skills assessment prior to your first pod sign up, or a public health nurse or someone or another MRC member who has been approved and trained as a skills evaluator may sign off on your skills on the day of your first pod. So just to let you know that there is a process in place. We want to make sure that we're doing this very safely. This is a new vaccine that has not been done before. So we want to make sure that everybody understands, all the parts and pieces of that. So for example, with the Moderna, you have to handle it in a specific way. For Pfizer, it has to be brought up to room temperature in a specific way, and also diluted for that particular vaccination. So we want to just make sure that everyone who is touching that vaccine vial is doing it in the appropriate way so that we are administering that as safely as possible. So we thank you so much for taking that training. So next slide, please. So here's some recommended trainings for those, who may be working in different capacities other than vaccinators. So these are, again, not required. So you do not have to take these, but they may assist you with understanding pod activities a bit more, and we encourage them. So the first one is our VDH Pod Essential Overview Training, and it's in Train at the course number provided, and it's about an hour and a half long. And it will kind of overview. We actually kind of updated it not too long ago, but it really overviews a little bit more in detail from what Lean went over today specifically. And then also our psychological first aid training, which is also available in Train at that course number provided. And that can really assist for specific roles, because as someone mentioned in the chat earlier, some people kind of, are nervous and everything when they do show up to receive their vaccination. And, COVID has been a very psychologically stressful, response just in general. So we definitely need those that are skilled in PFA to assist. So next slide, please. So we will take some questions in just a moment, but first and foremost, if you have specific questions, or if for some reason we didn't get to your question today, there are about 1,700 plus people here this morning, which we're so thrilled about. But if we, for some reason, didn't answer your question, you're welcome to reach out to us. So for specific COVID-19 questions, we encourage you to reach out through COVID-19@vamrc.org. Or if you have just general questions about how to become a volunteer, or if you're needing more information about your profile and VVHS, etc., you can email those questions to vamrc@vdh.virginia.gov. We really do welcome those, and we're happy to respond to them. I will say we have had quite a lot of people emailing us. So typically we have been able to, be able to respond within about 24 hours. That may be a little bit longer right now, just due to what Jennifer said, in the sense that we have we have over 23,000 folks that we're trying to respond to each day. So, with our limited staff, we have to make sure that we're getting in touch with everyone. So it may take us a little bit longer to do so. All right, and next one. So just want to tell you again, thank you so much. We're going to continue to take questions for a moment. but wanted to specifically say thank you because I really do understand the gravity of your service to us. And we all really are always in awe of our MRC volunteers and their willingness to go into the storm, so to speak, no matter what the circumstances or situation. So really thank you from the bottom of our hearts. We really appreciate everything that you do, and we really see you as superheroes, as close to a superhero in my book as you can get. So with that, I'm going to bring it over to Lean and Jennifer so we can go ahead and start answering some of the questions.
Hey, Megan, what is the secret phrase for this training? So
it's on the next slide, actually.
All right, go ahead, because everybody's asking. All right, secret phrase, everybody. Roll call.
Yes, so our secret phrase is Pod Rocks. So again, if you go to the vdh.virginia.gov MRC roll call link, and then when you're asked for the private or secret phrase, type in Pod Rocks. But do not type it into the chat box, because if you type it into the chat box, it does not count.
Yes, that's true. Everybody is asking kind of about the slides. We do have a training calendar page. So instead of roll call, you can take that off and put training calendar. And that has the slides for this training. It has the slides, I believe, for the orientation on there. So feel free to go back and pull down those slides if you want to have it, you know, for reference. I've seen that quite a bit. The quotes don't matter in Pod Rocks. No worries about that. And yeah, so I think
we have some. I kind of been following some questions, Jennifer. Okay. So there's a quick question since you're talking now. There was a retired surgeon general. He's asking if he can be a vaccinator.
So retirees, that's going to be coming out with the next EO 57 is going to change some of those allowances. So we're just going to, I can't provide direct on that yet. You can look at EO 57. We'll put something up on our webpage at the COVID vaccinator webpage. I plan on putting a click here to determine if you can be a vaccinator. And so we'll have that kind of all triaged out, because I think it might get a little complicated, but we're working on that. So out-of-state license, if you have an out-of-state license and it's a good license, yes, go ahead and take the vaccinator training. Go ahead and get it out. And then I think come next week when that EO is approved and announced, out-of-state licenses will be able to vaccinate for VDH. They can for hospitals right now. But for VDH, they will be able to. So
just a quick clarifying, we're seeing a lot of questions about caps and spaces and things like that for Pod Rocks. It does not matter. You can type it in any way. We just want to make sure that you are attending today. So you can type in Pod Rocks and you can capitalize the whole thing, or you don't have to. We just want to make sure that you made it to the end of our training, and that's how we're able to see that.
And then there's a question about CPR. Either you, Jennifer, or Megan can answer. Just in general, what's the requirements for CPR? And you can talk a little bit about the CPR.
Sure. So for CPR, it is within 2 years. And so we accept any CPR certification that's been valid that's still valid within 2019 and 2020. But if yours is expired beyond that, we do have access to the American Heart Association online training. And there's a scholarship for that. That's actually on the COVID vaccinator website. So you can click that and fill out the form so you can get a scholarship. You can take it online. We are not requiring the CPR skills, in-person skills assessment right now. So take it online. And then when we can offer the skills assessment, we will offer that to volunteers, and you can kind of get the second half of it. And you'll have a full CPR. You're gonna have partial for the moment, and then you can get together and get a full. You can go and get CPR without through MRC. We're just paying for it. We have COVID money to pay for your CPR certification. So feel free to go get it from somewhere else if you want to pay for it. Otherwise, we'll give it for you free.
And we are providing some preference to those who would be vaccinators. So I've seen some questions in the chat regarding whether or not you have to be medical to apply. You can apply, but do know that we are providing those to those that would be vaccinators to help move them along in the process, and they get priority.
Since you're in that, there's a question about the second dose, Megan. Maybe you can answer that, just to give a little bit of, like if some volunteers, they already have their first dose, they're asking when they can get their second dose, would they get the appointment once they get to the pod? If you can tell us a little bit about the second dose.
Yeah, so that's maybe a bit more specific to the locality itself. So what I would say is when you sign up to go to, another pod, you could ask there, or you could ask your MRC, unit leader specifically. Also, if you're receiving your first one, you can also ask the nurse that's giving you your shot. So once you're in our VAMS system, they should be following up with you for your second dose. But specifically for, if you're wondering if, when you would get it, if you're working at another pod, the day that you're getting a second dose, et cetera, you could certainly check with them to see what time they're going to be administering those, et cetera.
All right. So there's some questions about the closed pod that I mentioned earlier, so I'm just going to answer that. So the closed pod is normally for employers who have 50 or more. So it's for larger employers. So as a homeowner, you cannot be a closed pod. And there was some question about people who have they sit at home, an elder in the community. You would be an advocate if you know somebody who's elder and you heard there is a close by high school or a place where they're going to get their vaccine. You can let them know. Some people who cannot leave, if you have there's some question here about a person who has a company that they have people in home, that you can reach out to your health department or health district and let them know how many people you have, and they will be helping you coordinate where they can get the vaccine, or they can come to their houses and give them the vaccines. There was a question about the shifts, if there's a 12-hour shift or less. So we normally have 12-hour shifts, but you can always ask your unit coordinators if you feel like you want to volunteer, but you can't do the 12-hour shift. Let them know. They might be able to work with you to get your 4, 6, 8-hour shift that will work with your schedule, because we welcome everybody to come and help us. If you can't do the 12-hour shift, that's okay. We can work with you in cutting those hours. If you have any question in regards to your where to go to sign up to a pod, you will get emails from your unit coordinators. They will let you know when is the pod is going to be activated and where, and how to sign up. So these are some of the questions about pod and close pod.
And Jennifer, do you have something to add?
Yeah, okay, so the CPR thing. Okay, everybody, CPR. If you go, we will accept any CPR. So whatever CPR you have, if you have a card, put it in your application and in your profile in VVHS. All good. If you don't have one, we have American Heart. That's kind of the gold standard of healthcare providers. So you fill out if you go to the COVID form, the last thing on the list, the COVID vaccinator site, the last thing on the list is CPR certification. And it says, if you don't have one, click here to ask for a scholarship. Now we are receiving a lot of requests that it's not going to be immediately. Will Sanford is the point of contact. He handles logistics for us, and he goes in and approves and does batches with the American Heart Association. So it's not drive-through fast drive-through CPR. So it's taking us a little, but remember, we have a little bit of time because we don't have as much vaccine. So we will get the CPR. I think we have like well over 2,000 scholarships that we can give out. So it'll happen. If you have any problems, any questions like about your application or about CPR, you can email the VAMRC at vdh.virginia.gov email address. And that'll get you to our main inbox, and it'll be shuffled out to whoever needs to answer. So all right, so your train username is not the same as your VDHS username. So your VDHS username is what you created. Train automatically created a VDHS name for you. It's usually VDHS and some type of number. And if you go to our training page, and it's just again, it's kind of the same base page, and then we have the hashtag link. So it's MRC hashtag training. It talks about how to log in to train there, and you just use your email and it'll send you the username and it'll send you the password. And again, you have problems with that, you can go to the VA MRC inbox and we can also provide it to you that way. The training for non-vaccinators, really the training for non-vaccinators is that you take the orientation, and our preference is that you take this. I think Fairfax still has a requirement for 100 and 700. That's not the case for other ones. So if you've done the Richmond City MRC orientation, you're good. Richmond City has theirs, Loudon has theirs, and there's state orientation. You don't have to take both. So you're good. I can't see who it was. Caitlin. So Caitlin, you're good.
And there was a question about, can they work in a pod without being vaccinated?
Sure.
Yeah.
Yes, you can definitely work in a pod without being vaccinated. You know, you're welcome to choose how you do that. Just know that you'll need to wear a mask. Of course, as the governor's order is, everyone over the age of 5 is required to wear a mask at all times when, you know, outside in the public. So just be sure to make sure that you're bringing a mask whenever you're joining to come and work at a pod. Those that are specifically vaccinating or are in close contact will be given, you know, proper PPE once they are there, you know, such as gloves, etc., for them to use as they're vaccinating, etc. So,
Question about the skill check. How we normally do that, or can they vaccinate without getting their skill checked?
No, you cannot vaccinate without the skill check. The MRC unit coordinator will review your profile and know whether or not you need the skills check. And if you need it, often they're doing the skills check on site prior to clinic start. They might have a separate area where they're doing the skills check. And we also schedule like specific sessions for skills checks. So we're looking at doing like a Saturday skills check at a nursing school in the sim lab, and everybody come and everybody gets like a 15-minute appointment and does skills checks. So there's kind of 2 different ways of doing it.
yeah.
How about medical?
I'm sorry. There's a question about age. So just a reminder that most of our MRC units require volunteers to be 18 and up. I'm sorry, Lane.
No, it's fine. There was a question about medical malpractice. This is an emergency, but Jennifer can maybe talk a little bit more about
liability.
Yeah.
Oh, I thought I wanted to be a lawyer growing up. No. So we do have a website where we have legal information. Again, it's the same email, the same URL, /legal. But EO 60 is going to be amended next week. There is the PrEP Act. The PrEP Act is specific to the administration of the COVID vaccine under the emergency use authorization. There is so much liability coverage about the administration of this vaccine. And then again, if you attend the orientation, I mentioned about how MRC volunteers have the same liability coverage as any VDH employees. So there's layers after layers after layers of liability coverage. And I don't think that that should be an issue for anyone. I hope not. If you did not attend the orientation, if you go back to the training page, the training calendar page, or you can go to orientation, MRC /orientation. The orientation's recorded. I haven't set up a time for the next one. I need to do that. But it is recorded and you can take it there.
And there's some questions specifically about N95. So just to let everybody know that N95s, we, according to the CDC guidelines, we are reserving those for, you know, situations where there is aspiration of potential for COVID. So for example, at testing sites, those folks wear N95s. Within the vaccine unit, we ask that anybody that is working within 6 feet of someone is wearing a surgical mask. So for example, the COVID vaccinators are wearing face shields and surgical masks. And then, you know, everyone, as I mentioned before, is required to wear a mask in the public spaces.
There's a quick question about positions and where people can be placed. I think your unit coordinators will look at your profile and determine based on your training and your license what role you can play in a pod. And leadership are welcome. So if you're a volunteer, if you've done a lot of planning, organization, logistic, you can always be a unit leader or a supervisor. I mean, there's no limit to what you can do as a volunteer if you feel capable and ready and trained for that particular position.
Great point, Lane. That's probably a really great point to end on. So we really welcome you to all, decide what is the best role for you to play as COVID-19 vaccination really kicks off. We thank you so much again from the bottom of our hearts for attending today's session and for your willingness to vaccinate. And we appreciate you taking the time out this morning. So with that, we're going to stay on for just a moment, but we will be ending today's session. And we thank everyone. Thank you, Lean. Thank you, Jennifer. And thank you, Marshall, specifically.
Hey, we love Marshall. He's awesome.
He's not here today, but we appreciate him too. And we thank all of you again for being on the line with us this morning. We hope that you have a great rest of your day.
We'll try to answer some of the follow-up with some of the questions in the chat box, but we'll mute ourselves. So we'll give it about 5 minutes after 12 and answer questions for you in the chat box as best we can.
Thank you. You all rock.
Thank you.
Guys.
Yes. Virginia MRC rocks. My wheel is spinning and I can't enter anything else in the chat box. So I'm chat frozen, Megan, just to let you know.
I am too, Jennifer.
Oh.
I think it's because we're having a lot of people move in and out of their room.
How many did we have in total? 1,608.
For my view, it was over 17, but I didn't see the specific number.
Okay. It was a good day. Good training, good session, good day.
It was 1711.
1711. Holy moly.
Feels like 7-Eleven.
Thank you, Veronica.
Thank you, Veronica, for facilitating, and thank you, Adrenia, for doing the slides.
Thank you, everyone.
Secret phrase for NIMS on the 9th. What is that? Which one was that? The ICS course. So that would be James. Adrenia, do you know what the secret phrase was?
ICS rocks.
ICS rocks. Can you see a theme? So Charlene, ICS rocks. Sorry, we can't tap in the type in the chat box. We're so busy. All right, well, I think I'm going to be hopping off and reviewing volunteer applications and approving the 2,000 people that have applied this week.
So just as a reminder to everyone that's on the line, you know, feel free to reach out to us with questions. I know we're having a little trouble with the chat box now, so we weren't able to fulfill those chat questions. So if you have those specific questions, feel free to reach out. If you have admin type of questions, you can reach out to VA MRC, or if you have specific COVID-19 questions regarding immunizing or anything of that nature, you can reach out to the COVID-19 address here.
For any position or leadership roles, reach out to your unit coordinator. Let them know what you have and what you can do, and they'll be able to place you in those positions.
Great. Thank you, everyone.
Thank you, everyone. Have a great weekend, great afternoon.
If you can't log your training, email VAMRC at vdh.virginia.gov and we'll get it taken care of for you. For some reason, the roll call doesn't work. It's all right. Yeah, you can do roll call at any time.